I'm Mary.
And I'm Mike.
Okay, about a year and a half ago, I was diagnosed with stage 1 breast cancer, hormone positive, HER2 negative, and yeah, I was shocked. Just wasn't a lot of cancer in my family. I was more concerned, I suppose, in the back of my head of heart disease that my mother had than I was of any cancer. So it was a shock. Yeah, that is a story that starts before I was diagnosed. And it starts from more of Mike's side of the family who experienced some cancer and friends of ours, right?
Yeah, I mean, my father was diagnosed 8 years earlier with a serious pancreatic cancer. And I saw what he went through in the treatments, and I could see that this was probably not going to work for him at all. And then I had a lot of other friends and associates that had cancer, and most of them didn't do so well. And I was kind of took it upon as a hobby and interest in those succeeding years after my father was diagnosed to see what else was out there in terms of, more, holistic or other kinds of things supplementing the traditional treatments. And so I was somewhat knowledgeable of different organizations and opportunities out there. And so we kind of felt when she got diagnosed that we would, explore both avenues. Well, ultimately, I had a friend whose wife was going and getting some treatments at a center where Dr.V worked at, and we were looking for some place that was regionally close to where we lived, so we didn't have to, fly in an airplane and go somewhere, but also had all the kinds of treatments that I'd been exposed to in terms of the alternative world, if you will, in addition to the traditional stuff that we did when we first got diagnosed to get a lumpectomy, that kind of thing. And so we came across Dr. V at the facility in Orange County. And
this was after we had already gone through a path before we had met her of a cryoablation. So we decided from the beginning, instead of going right into surgery, to freeze the tumor. And that is not mainstream now for breast cancer. It is for some other cancers. But after our research, and we felt very comfortable having this cryoablation. And so what it did is it totally froze my 1.5 centimeter tumor. And so then I did go in for a lumpectomy after that. And what they found was just a heap of dead tissue. They sliced it 1,000,000 times and found nothing. So that was the beginning of our, path by taking that first step, which wasn't, mainstream of going through, the cutting and the burning. So, and then I opted out of the burning. I opted out of radiation. Just didn't want to do it and didn't feel it was the right choice for me, given the dangers later on of reoccurrence and the load of radiation you get for what I had, which was now a small, dead, stage 1 tumor.
And one of the reasons we did the cryoablation so soon is because, and there's schools of thought on this, but even getting the biopsy itself disrupts the tumor, I guess, and could shed cells or whatever. So it was comforting to know we were going to do the biopsy and the cryoablation at the same time. So they did the biopsy, and the person who did the biopsy also did the cryoablation in the same procedure. So it gave us a little peace of mind, although some schools of thought may say that's not a concern. But at least for us, it was something we were comfortable doing, and then we went from there.
So then we land, at Dr. Von Schaefer's space and just hit it off with her immediately. She knew, my path where I had gone, and we were ready to go for wellness and get away from, these harsh treatments, which I chose not to do. So, and that was just beautiful. I mean, what she introduced us to, so much we didn't know, too, the mistletoe and the saliciniums and the different other treatments that I think is really going to benefit me in the long run. What we're, trying to avoid, of course, is reoccurrence. And it's scary out there. I mean, the reoccurrence rates are high. But we found that I do have, an Epstein-Barr that's kind of raging in my body that is not helping me. She's addressing that. I have low white blood cell counts. She's addressing that. And so my other doctors, wouldn't address that. It's big.
And that's really the appeal to go to Dr. V, is sometimes the treatment could be worse than the condition. And so I had read a lot about the impacts of chemotherapy and radiation. And it took comfort that even our mainstream doctor didn't think we needed to do the chemo, which was good. But if we did, we would have probably considered like insulin potentiation therapy instead, because it's not as taxing on the body. Because it's also the healing process long after the treatments are over, so your body is getting a good situation where it can, continue to keep you cancer-free. And we also like the monitoring part of what Dr.V does. We kind of look at things like circulating tumor cells and virus counts, and so we don't have to just cross our fingers every 12 months or 18 months
when a scan happens.
Hope the scan goes well. So it gives you a little peace of mind, and that's what worked for us. We still don't ignore some of the other traditional monitoring things. We may get some sort of ultrasound periodically anyway. We certainly value that contribution, but the core of Dr. V's practice is where we've kind of put most of our emphasis, and we feel good about it.
Don't jump right away with what they're going to tell you with your regular doctors. There's so much information out there. There's so many other choices. And that needs to be heard, and that's kind of why we're here today. We think that being educated all the way around, people act in fear, and when they act in fear, they just they jump to the common space. It's not always the right choice, for sure. So that would be my advice, I guess. What would you say?
Yeah, I think everybody that's going to help you, wants to do the right thing by you, whether it's traditional means or people like Dr. V. And so you just have to ascertain, based on a lot of evidence and a lot of work and research, what works best for you. And sometimes some people will just go totally holistic, some will go totally traditional, some will do combinations. It's up to the individual. I think for us, for
and
Mary,
up to the cancer, the type of cancer.
Yeah, the situation you're in and that kind of thing, it gave us peace of mind. And so for that, we're thankful.
Yeah. More than that, too. I believe she's getting me well all the way around in a lot of ways. That, yeah, she's great. Wow, now it's settled in, and, it's still a strange new definition for me. So it still doesn't sit well. But when I feel that people are talking about, oh, yeah, I'm cancer-free, they're not saying anything, I don't go down that path. So now my evolved, definition and feeling about it is it will always be a part of me, and it will always need to be watched, even if they're not finding any new mass or any other, indications of resurgence, recurrence. And I think that's a different definition in my mind than what I talk to other people and friends that have had cancer. They say, oh, I'm free, I'm done, boom, out the door. Well, I don't think it works that way, and I've learned that from Dr. Von Schaefer. I've learned that there'll be a watchful time. A little bit more intense at the beginning, then lessened, and then checking up on these other things that are really important to know about: your inflammation, your viruses, other things.
Yeah, but
right?
I think it also takes the fear away, because you're sort of informed and you're sort of going proactive. Other people may choose to say they're, I'm done and not think about it, right? And but ultimately, to be vigilant and not like it absorb your life or anything. I don't look at Mary as a cancer patient in my mind, right? She's the same old Mary, and that good. But it takes the fear away. You have some control of your life and your health, and it kind of spills over in other aspects of your health, right? Because what you're doing to help your body in the cancer situation helps your body in other facets too, in terms of overall wellness, health, heart disease, whatever. So it's kind of put us all on notice a little bit to be a little more aware of your health and how you can keep it.
And in also kind of a spiritual way, it awakens you. And so, we take every day, and we're thankful. And we live our life with happiness. So I think, you do. There's this wow of, okay, things could end sooner than you thought or whatever. But so I think that there's that kind of spiritual awareness that I think has happened to us too, a little bit.
Yeah.
Right?
Yeah, absolutely. For sure. We're not in this alone, that's for sure.